sometimes the challenge is that the vocabulary to describe something and the mental model with which we approach a particular problem are very, very different.
So I think we need to understand the needs along a developmental continuum or the needs of different groups of people and make our responses important for those needs. Now, we must also understand that our mental makeup depends on a whole host of things. Our sensitivity, our temperaments. There is a certain biological component to that. But that doesn't mean that we cannot regulate it or cannot be in control of it.
The same child for a health practitioner is different from an education practitioner to somebody who looks at protection. Versus a city is today in the hands of a lot of administrators. Is there ways in which we can achieve a greater convergence across some of these departments?
Parents of children who have serious difficulties, family members of people who have to deal with very severe illnesses like cancer, other chronic diseases. We need to develop support systems for them. And I think these are all the gaps that we have. We need to look at worker organizations to make sure that they incorporate also elements of mental health and well-being into their programs. In Karnataka, having a psychiatrist service available in every prison, offering counseling and psychotherapy is something that's being done. In Punjab, handling drug abuse, in the different prisons is something that's being done.
The number of elderly in India are going to go up, and there is today both an opportunity conversation around how can we engage them better and a risk conversation on what do we have to take care of.
And one example is daycare for the elderly, so that when people go out to work, they are reasonably sure that elders have an environment where they can go to, be safe and be productive, where young people kind of got involved in doing little chores for the elderly, spending time with the elderly, reading to the elderly. And I think that's a fantastic model, where young people can get involved. We need to look at both existing systems of care and perhaps newer ways and newer and innovative ways, especially using technology to reach out to people in a meaningful manner.